the next highest week that we have seen. Omicron is significantly more contagious than even the Delta variant. And if it spreads at the rate we're seeing, it is certainly going to fill up our hospitals. For those that think it's just the common cold, when we show you the growth in hospitalizations and how the line is almost going straight up, it should tell you that if we don't take this seriously, people die, and not just people who contract COVID. People who have heart attacks, people who have strokes, people who are in car accidents because beds are taken up primarily by unvaccinated Kentuckians, leaving no room for those that need other help. Let's go through first the cases through the weekend. Saturday, 6,750 new cases, 32 new deaths, including a 32-year-old woman in Bullock County who died on Christmas Day. Sunday, 5,235 new cases, 21 new deaths, and they include a 47-year-old man from Fayette County who died on the 6th of January. Today, 5,049 new cases of COVID-19, 14 new deaths, including a 21-year-old man from Johnson County and a 34-year-old man from Jefferson County. As of today, our positivity rate, 26.33%, meaning now more than 1 in 4 people who get tested are testing positive. We have never seen that before. All right, let's show you the stair stepper chart. Last week, we had 52,603 cases of COVID-19. Our previous record was 30,680. And still, as Dr. Stack will tell you, we are nowhere near the overall incident rate that we are seeing in New York, meaning it's a possibility that that peak could potentially even double, depending on our practices and what we do. We have never seen an escalation like this. When you go back to the start of Delta and how severe the curve looked, how it looked exponential, that was a parabola that looked exponential. This one is a straight line up like nothing we've ever seen before, proving that this is one of the most contagious viruses in the last 100 years. There's nothing other than maybe measles that rival it. So, yes, we believe that overall it causes less severe disease generally than Delta. But if it is already double the number of cases of Delta, if it may double even where it is right now, it could be a quarter as severe as Delta and have the same harmful impacts. So we have to take it seriously. Positivity rate last week, again, an all-time high, and it sadly puts to shame what was a very deadly curve, an exponential curve of Delta on the increase. We continue to see higher and higher numbers. And remember, we have a ton of people getting tested right now, and still over a quarter of them are coming back positive. Hospitalizations are absolutely being impacted. Our hospitals are now filling up. When you look at this graph, it is now increasing pretty significantly. And if we continue that trajectory, all of our beds will be filled very soon. ICUs, sadly, also filling up. That once we see increases in ICUs, we certainly later see increases in deaths. Now, ventilators may not increase at the same pace given how Omicron hits you versus Delta. That does not mean we won't lose a lot of people and that the hospitalizations aren't very serious. Hospital capacity. We haven't shown you this graph in a while. That's the one of the state. If we can. It's the one that looks like this. And the reason is that of the 10 regions that we track, 9 are now in the red. meaning we have ICU and or hospitalization issues in each and every one of the regions. Hospitalizations have increased 17% over the last 7 days on a rolling average. We're down to 134 adult ICU beds available. 33 of 96 hospitals reported critical staffing shortages. We have 23 pediatric patients, kids, in the hospital, 4 in pediatric ICUs. And remember, we only have 2 pediatric ICU units. And we have 3 kids on ventilators here in Kentucky. Because of this rapid escalation in hospitalizations, I have authorized and mobilized the National Guard to assist in our hospitals. Again, okay, here is hospital capacity by region. You can see how concerning it is with 92.8% of ICU beds filled up in the 5th region. And as you look around, so many of them in the 97 percentiles. This increased rapidly all across the state. And remember, it looks like we are just on the escalation, not the peak and not the decline for Omicron. Plan right now is between National Guard we already have out there and ones we are going to be sending to other hospitals. We'll have about 445 active guardsmen and women assisting through hospitals and at the moment through our food banks. They'll be assisting all over the Commonwealth with the exception of hospitals that didn't need them yet or have other plans. The way we prevent this happening from our hospitals being overwhelmed are vaccinations and boosters. It is an incredibly clear pattern, more so I believe with Omicron than anything before it, that the level of your vaccination correlates almost directly with how hard this thing impacts you. If you are vaccinated and boosted, most people will say it's like a cold or they don't have any symptoms at all. If you are vaccinated but not boosted, you are having waning immunity. It hits people and they feel like some people did with the original version of COVID. If you are unvaccinated, for many people, this is hitting you like a freight train. And the vast majority of those ending up in the hospital are unvaccinated, but you know what? That impacts everybody else too. First, it impacts their families that have probably tried to get that person to get vaccinated, but don't want to lose them. Impacts the communities, impacts our healthcare workforce because it can spread there and we can have less hospital staff and thus less capacity. But it also hits us, and if we fill up every hospital bed, people who are injured, hurt, have a medical condition that's not related to COVID, can't get the treatment that they need. So it harms everybody. If there's a bright spot, it's that we continue to see steady vaccinations. Over the weekend, 11,672 Kentuckians decided to get their first shot of hope. That's 11,672 new Kentuckians on the way to vaccination. The fully vaccinated number, a little bit better, 7,122 got their second shot to become fully vaccinated, and 23,283 got boosted over the weekend. That does increase, and I don't think we have this later, our percentage of Kentuckians fully vaccinated and boosted to 21% from 20%. If you've been waiting, if there is some excuse, please go out and get boosted immediately. I can't tell you the number of people that I've talked to that ultimately they were okay or they felt sick, didn't necessarily have to be hospitalized because they were fully vaccinated, that are just put off getting their booster. And they wish that they hadn't. In the very least, being separated from their families or their jobs, get that booster and get it as fast as you can. Let's look at the change in demographics for vaccinations. We're now over 2.8 million Kentuckians vaccinated, 2,807,380, and our very top number went up. We've gone from 62% to 63% of every man, woman, and child in the Commonwealth of Kentucky that's had at least one shot. This is the hardest number for us to move, and it continues to increase. That is a good sign. This is unprecedented in how quickly we've vaccinated this much of the population compared to anything else it seems we've ever faced. This would go a whole long way towards fully and finally getting through it. But the adversary we face, we don't get to pick. And what it takes to defeat it is what it takes to defeat it. So we do have to do more. 5 and older, still holding steady at 67%. That's still 2/3 of everyone eligible. And 74% of 18 and older, those are people who make their own healthcare decisions. Now, both our green and our yellow zones, that's Kentuckians 25 to 75, have stayed the same as a percentage, but we are seeing some positive movement in kids and or young adults, which is the area where we can make up the most ground the quickest. It's also an area that we're already seeing schools that are having to call off in-person instruction, and a major driver is we don't have half the kids that are in those schools vaccinated. You know, this is a decision we need people to make if they want to be able to stay in school for as many days as possible. So 18 to 24-year-olds up 1% to 54. 16 to 17-year-olds now up 1% to half. That means 1 out of every 2 16 to 17-year-olds in Kentucky that are going to be social, and we want them to be social, aren't as protected as they need to be because they haven't gotten vaccinated. 12 to 15 staying the same. 5 to 11 up 1% to 18%. This is one where we really can and we should do better. Dr. Stack on a webinar today talked about the number of doses worldwide that have been given under the highest level of scrutiny from experts and social media experts alike, and how well these have held up, and the lack of any real harm that's come to kids at all of any long-term nature from these vaccines. My son's getting boosted today. He falls in that category that is finally able to. I love that kid and his sister, again, more than life itself, much more than anything else other than my wife and my family and my faith in my life, much more than this job. And if I thought it would harm them, even though in this job I have to talk about vaccines, if I thought it would harm them, I wouldn't do it. And I'd take whatever consequences would come with that. But I know it helps them. I absolutely know. And that's why we made that decision, which is, I think, the right decision. I'm going to turn it over to Dr. Stack for a number of updates, and then I'll give just a couple of tornado recovery updates. I will dispel some misinformation on a different topic that is out there that is unfortunately just a new lie on social media, and then we'll get to questions.
Good afternoon. Thank you, Governor Beshear, and hello, Kentucky. As Governor Beshear has already shared, Omicron is setting new record highs for the numbers of new cases and test positivity rate on a nearly daily basis at this point. The Omicron phase of the pandemic is both remarkable and distinctive from prior surges. If I could have the first slide, please. So I haven't shown these for a while, but here we see Kentucky's journey in cases from the start of the pandemic to the present time. So this and the next slide are taken from the website 91-divoc.com this morning. So we first note the massive winter surge in 2019 to 20. It was both high and very sustained for nearly 5 months from plateau to plateau. Then from March 1st to about July 1st, 2021, COVID-19 vaccinations coupled with warm weather and a movement to outdoor activities brought a summer period of relative normalcy. I'm sure we all remember that fondly. It almost felt like we were getting normal again, and a hope that the pandemic could be in retreat. Low vaccination rates worldwide and even here in our own commonwealth and our own nation, though, enabled a new and worrisome Delta variant of COVID to surge swiftly and intensely from early July until mid-November. This Delta surge overwhelmed many of our hospitals. resulted in a record number of deaths and really never fully receded before Omicron arrived. And then finally, we are now on a nearly vertical spike, the likes of which dwarf all prior escalations. In just 2 weeks, Kentucky has gone from roughly half of our Delta surge peak to more than double our Delta peak. At this point, essentially all COVID-19 is likely to be the Omicron variant. So let me just be clear about that. It would be our belief at this point that 95% to 100 of COVID-19 in Kentucky is probably Omicron now. Mercifully, Omicron appears to cause less severe disease, particularly among people who are vaccinated. The positive impact of more than 65% of all Kentuckians 18 and older being vaccinated, plus some protective value of prior infections, has helped to blunt the proportion of Omicron cases with severe disease. Even so, unvaccinated persons are again straining hospitals with their severe Omicron infections. Having lost many staff due to pandemic exhaustion, plus more staff going out sick themselves with COVID-19, the hospitals are making difficult choices to limit and postpone important but non-urgent services in order to have staff to care for COVID-19 patients. As a result, ER wait times can be very long, and many rural hospitals are reporting they are unable to find hospitals to accept ICU-level transfers, with the result that very sick people can remain stuck in small rural hospitals for extended periods of time without access to subspecialty medical and surgical care. If I could have the second slide, please. And yet, we still have a long way to go. New York, which is in the orange line here, started this Omicron journey a couple weeks ahead of Kentucky. Even after adjusting for population size, the rate of disease in New York is more than twice. It's actually about 225% more higher than Kentucky. Even if Omicron remains a milder disease, with our hospitals already struggling now, the next few weeks could get much worse. We're not powerless, though. I've said this repeatedly. We're not powerless to have a positive impact on our future. So first, do not go to an ER just to get a COVID test. Do not go to an ER just to get a COVID test. If you can't get a test but have mild to moderate illness, stay at home and do not go to school or work until you feel better. If you are sick and feel you need medical care, call your doctor. Go to the ER, though, if and only if you think you have an emergency. They are there. They will help you. They will do the best they can, but do not go to an ER just to get a COVID test. Second, if you are sick, stay home until you feel better. Next, get vaccinated or boosted if you're eligible. Boosters dramatically bolster your protection against severe disease and death. Next, wear a well-fitting mask at all times when indoors in public places such as school, work, stores, theaters, or any of those other settings. And finally, if you think you have COVID-19 and or have had a high-risk exposure and you are able to get one, go ahead and get tested. Now, I just want to acknowledge it's hard to get a test sometimes now. This demand is unlike anything we've ever seen before, and that's saying a lot because this whole pandemic is unlike anything any of us have seen before. If workplaces and schools don't do these things, Omicron will run through like a wildfire and quickly shut places as entire offices, assembly lines, and classrooms are idled not by government or anyone else, but by absent ill employees and students who don't report to work or to school. The final slide, if you could, please. So this pivots me to schools. Schools can safely remain open for in-person instruction while minimizing disruptions to the learning environment when they implement layered prevention strategies. In light of CDC K-12 isolation and quarantine guidance that was revised late last Thursday, KDPH has revised its recommendations for K-12 school operations and test to stay for Kentucky schools. I'll walk through this slide row by row. First and most importantly, universal masking is essential with Omicron. If universal masking is not required in K-12 schools, Omicron will spread rapidly and result in rapid and massive student and staff absences due to illness. Now, in the first row, in any situation, if you are sick, stay home. If you are sick, stay home and do not go to school. Whether you have COVID-19 or any other acute infectious disease, do not go to school or work. Stay home so you don't spread disease in the midst of a pandemic. And the second and third rows on this table here, if a school requires universal masking, so if a school requires universal masking, then it does not have to do contact tracing within the school population if a positive person is identified at the school. Second, a school does not have to quarantine any of the students or staff in the school population if they find a positive person in that setting, if they require universal masking. Now, this is very important. These two tasks, contact tracing and quarantine, are important in schools without universal masking because unrecognized sick persons with COVID-19 are almost certain to spread Omicron. And also because unmasked persons are more likely to catch Omicron from infected persons. It's all or none. Universal masking requires everyone in indoor school settings to mask. In schools that do not require universal masking, the schools are urged to maintain robust contact tracing when positive persons are identified in the school setting and to quarantine all persons not up to date on their COVID-19 vaccination if exposed in the school setting. And then finally, in row 4, individuals who are not up to date on their COVID-19 vaccination. So this would be persons 18 and older who either are not within now it's 5 months, within 5 months of their second dose of an mRNA vaccine or within 2 months of their first dose of a J&J vaccine. Anyone outside of those windows is eligible for and should go get a booster. Persons under 18 are not yet in that category. So for anyone who is not up to date on their COVID-19 vaccination and who is exposed to COVID-19 at home or in school should quarantine for at least 5 days unless participating in a test to stay modified quarantine program is described by the Kentucky Department for Public Health. In every scenario the CDC outlined in all of these revised guidelines, they rely on the use of masks for 10 days after an infection or after exposure. So folks, the universal masking is central to all this paradigm. Now look, we are all eager for this pandemic to end. Until it does, we will all fare better if we pull together. And I want to just thank you, Team Kentucky, for pulling together. It's been a long road, but we've come through a lot together. And for what it's worth, I haven't given up hope yet. There are better days ahead. We've already made progress, and even though it's incomplete and this tires and taxes us, better days are ahead, and we will see our way through this. Thank you very much. Thank you, Governor.
All right, so just a few updates on our efforts on tornado recoveries. 1 month since the deadly storms hit. Currently, Kentucky State Parks open their arms and their rooms and their cottages, and they're providing housing and food service for 480 displaced Kentuckians and 139 first responders. There are 177 state park rooms occupied by displaced Kentuckians, and 99 rooms have been provided for our first responders. I made the announcement some time ago that we would ensure that housing for 30 days, which would end today. We are extending it another 30 days. So to those that are displaced because of the tornadoes staying in our state parks, we got you. We're going to make sure that we can make that transition to the semi-permanent housing and do it the right way. But we know where things are right now, and we are going to keep that room, that cottage, whatever that housing is, available for you for at least another 30 days. We also got news since our last press conference on our request to FEMA to add another 90 days to the 100% match. We were turned down. However, we did get flexibility. We still only have 30 days of 100% coverage for 2 general areas. They're called A and B, but we can now choose in the first 120-day period which 30 days we want the 100% on. In other words, we can figure out the costliest 30-day period then the federal government will cover everything on it. Listen, it's not everything we wanted. We are going to ask for something different, at least a little bit more help, but it is going to be significant. And so now we've got to be thoughtful, and we're working with county leaders and others about what the best time period is to run on the two. And really, to simplify it, it's debris removal, which is one huge area. And you look at Graves County, that's going to take through the end of April. All right, so you look at how long that period is. It's right now at 120 million, and just in Graves County. And so there's going to be a substantial portion outside the 30 days. So one of the reasons I've asked for the legislature to be authorized to cover, especially the county amounts. We have an amazing budget right now. We can cover that. It would bankrupt the cities and the counties. A direct authorization to use those dollars, I don't think is currently in the tornado relief bill, but it is in the authorized uses in the end that I guess you come back and ask for. But now with the way this FEMA 30 days works, it's going to have to be a sooner rather than later. So we're going to work to get that changed a little bit. Second piece is temporary housing, which would include the travel trailers. We're supposed to call that non-congregate sheltering. For FEMA to recognize that it's reimbursable, so it's non-congregate sheltering, as well as a number of other expenses that were even the search and rescue. So figuring out those 30 days and when we want them to start, we can choose any day, but then the 30 days have to run consecutively is one of our next big challenges. We'll be working with the state legislature. We had worked on tornado relief, and then we didn't hear from them for a couple days, and the bill that was filed is pretty different than the last one we directly communicated on. Want to work with them to address any concerns, but also know that upfront dollars weren't appropriated for things that are needed for other things that upfront dollars were appropriated for. So there's $15 million, say, for travel trailers, which we need and we discussed, but there's no money for the utility hookups and the running extra water and running extra sewer, creating the pads in different places. They're going to be necessary for those. So still work to be done. We hope to be able to work, and I think we expect to be able to work with folks on that. Finally, I want to clarify something that appears to be a very coordinated effort on social media. This administration has not increased vehicle tax rates. The executive branch cannot increase tax rates. That is done by the legislature. It appears some people have seen that their overall tax bill has gone up, and they're trying to suggest that this administration has increased their tax rate. That is not what has happened. What has happened is your car is worth more. Just like when your house appreciates and is worth more, the tax rate is a percentage of the overall property value. Right now, used cars are in such demand that value, as opposed to depreciating the last couple of years, has actually increased. That right now you could get the most money for your used car probably that we have seen in 10 years. So the way that taxes work is the legislature sets the tax rate, and that is multiplied by the value of your car, which is a process that looks at the overall market of what it's worth. So I don't know how many Pinocchios are absolutely entirely false, but however many there are, that's false. And I hope that we can move past that. Now, as easy it is to simply lie on social media, it is worse when you know it is not true and you're trying to take advantage of people for whatever reason. All right. On that happy note, we'll open it up to questioning. We got 4 journalists that are here and a whole bunch on the line. So we'll start with Karen Czar.
One on the guard and one on COVID. How stretched then is the National Guard, especially since how many are still deployed up in Kentucky? And then hospitals in other states are reporting a high number of people being admitted for other conditions and then testing positive once they're admitted, and they're seeing a spread within the hospitals. Are you getting reports of that as well?
We are seeing spread within hospitals for staff. It is a serious concern, and it impacts the number of available beds, hospital capacity. Our prime concern on hospital capacity isn't physical infrastructure. It's the number of staff available to help, and that's why the National Guard is going to be helping. The National Guard presence in Western Kentucky has been significantly reduced over time, very naturally, and with the complete agreement of local officials that are there. It was a very collaborative process. With that said, a lot of our deployments have been solely voluntary. This one is not going to be solely voluntary, and that we're going to have to reach out and actually order some people into service. But I cannot think of a higher calling right now in what is a war, and the deadliest war in our lifetime, of ensuring that we can increase hospital capacity by using the Guard. Mike.
This may be a question for both you and Dr. Stack, and I don't bring this up to be alarmist. I just wanted to see if this was on your radar right now. But researchers in Cyprus say they have identified the strain called the omicron, or sorry, the deltacron, rather.
The deltacron.
The combination of omicron and delta.
That's like combining Godzilla and King Kong.
Yes.
Got it.
Exactly. I just wanted to see if that was something that you had heard about. And I guess my broader question is, when you hear about the emergence of new variants, potentially more potent variants, does that change your calculus or medical professionals' calculus on the need for boosters?
Question is about a new potential variant that's out there. At this point, we have seen so many of them potentially pop up that what I do and what I think we need to do every time is take a breath, right? Within a week, some of them are gone or not proven or didn't catch hold. What we have seen thus far is a number of these things, but then something comes along that becomes the dominant strain and almost fully takes over, not just in one country or one area, but worldwide. For me, I don't see in the coming weeks anything taking over from Omicron in the way that it's spreading. We all hope that while we don't want a whole lot of people to get it, maybe it moves us closer to some conclusion, some herd overall immunity, some endemic nature, then that could mean 100 different things. That word's being thrown out. That could mean everything from this in the future being like a cold or the flu or the measles, and those are three in totally different scenarios. So, I'm not concerned with initial reports like this. When we start seeing something like Israel and UK and South Africa and how it happened, then it's a little different. But man, they're calling it Deltacron. And that's like the name of a made-for-TV movie that's Sharknado 4. Not that I know what that movie is. Grayson Passmore.
Yes. Is there any consideration for the National Guard to set up mass testing sites again since the demand is so high and growing?
Well, right now, as we look at whether or not mass testing sites in different parts of the state would work, is testing materials that are as concerning as anything else. And while if we could get more testing materials, let's say, and we did increase volume on a day, would it increase the amount of time that the labs get back to you? If we go way back in time, remember how it would take a week or 2 weeks to get your testing results? And that's one of the reasons we built out our own with Gravity, because it just doesn't help. So those are kind of the three things are the number of people wanting to get tested, the amount of testing materials, the amount of tests themselves that we can get, and what the turnaround time would be. Right now, we don't see an advantage with expanding the locations, given that they're already filling up. But if we got significant more testing capacity and we could turn it around on a reasonable schedule, then it's something we'd certainly consider. I do believe that even with something like this, as take-home tests increase, and remember, a ton more people have Omicron than we've even shown because they test positive at a take-home test and hopefully do the right things, and I think they do. But a healthcare professional or the health department may never get that. Austin.
Thank you, Governor.
Sure.
One question on the Ford plant that's coming. Was your office involved in deciding who provides power to the Ford and SK plants in Hardin County, and did you direct that KU be the power provider there?
We worked with both potential providers to reach a successful outcome for those providers and for Ford. Tom Latek, Kentucky Today, and I know there'll be a question.
You better believe it. And first off, I can send you a link so you can watch Sharknado 4 if you like.
There you go.
The House House A&R today passed House Bill 5 and Joint Resolution 29. 29, of course, is the one that extends all executive orders through the end of the session. And also House Bill 5 is $200 million. And you've probably seen how they divide it up. What would you like to see in addition to that $200 million?
So first, very appreciative of the resolution that extends the state of emergency. We'll also be getting requests from county judges that can also operationalize and continue that state of emergency. We worked very well together on that. I think that the relief bill is a good start, but it departed really significantly from the last draft that we had real significant conversations with and haven't yet received any explanation for the significant changes. So overall amount of money, good. Possible usage for the money that's in the back, good. But it basically says we're only providing $45 million now. And that's $15 million for the travel trailers we talked through, but we also talked through amounts of money that we're not going to know exactly ahead of time that it's going to take to hook them up and to make them successful. And that's not in there. There also isn't any money upfront for local share of costs that we've got to pay for on that FEMA is not going to cover. There's also zero flexibility in the short term to make expenditures through that bill. Now, there's some separate authority during states of emergency about things that are going to come up immediately. One area that we need to help on that we'd ask to be included is to use those funds to provide low interest loans to farmers for straight line fencing, because that's not covered under insurance. The U.S. agriculture loan for it requires 100% collateral, which nobody take a loan with 100% collateral. If they could do that, they just pay for it. And so we need to find a solution there. And there's so many other things that come up every day. And I talk to these county judges and others, fire chiefs and the rest, weekly, if not daily. And right now, what the bill says is every time we want to do a new expenditure, at least the way I read it, and if they read it differently, then wonderful, but that we have to come back in, and the legislature only acts through a legislative action, which would be resolution or bill. And for every expenditure as it arises to go through that process, you can't rebuild towns that way. So listen, I know it's just a start. The overall number and a number of other pieces in it are really good, but sometimes FEMA's interpretation of something will change 3 times in a week, and we've got to be able to be fluid and flexible on our side too. And I know that that's what the locals are working for. Now, I have assured locals that we're going to get it done no matter what. The rebuilding, we're going to be there for their needs no matter what, and I believe everybody believes that. Corinne Boyer.
Hi, Governor. Do you have an update on the COVID outbreak in prisons? Is there an estimate of how many people have tested positive and an idea of how sick people might be? Thank you.
In good news, it is significantly less than the initial wastewater testing might have suggested. They've gone through, they've tested a whole large portion, I believe in KCIW, which is the one we were concerned about the most. We have 10 correctional officers and just 2 prisoners at the moment. Now, in a confined space like that with something like Omicron, that could go to half the prison in 3 or 4 days. So we're not resting on that, but I will say this is showing the wastewater program works. And if we can hold the infection down, it will show that it is a very good early indicator that can then spur action. So it is much better news than I expected to provide, but we are going to get the numbers for all the other prisons as well. I believe we're from the numbers I got today, 75% or right around there for prisoners vaccinated. So we are providing boosters as well. Debbie Yetter, Courier-Journal.
Hello, Governor. With the current Omicron surge expected to continue through January, is it really, have we missed the chance to get more Kentuckians vaccinated? Is it too late to make any kind of dent in the spread of Omicron, given the time it takes to develop the immunity and the vaccines to take hold?
So that's a good question. And yes, I think everyone that gets first shot, second shot, or third shot does their part in lessening the spread. But I think our main goal right now has to be to not allow our hospitals to get overrun. So even if we can't reduce the spread of it, how sick you get from it, whether or not you will be hospitalized, absolutely can be impacted today, tomorrow, and the next day by people getting their booster or getting their first shot. Now, my belief, and we'll know this at some point, is you get some level with every single shot. So your chances to be hospitalized, I think when they are able to look at this holistically, years from now, your chances for being hospitalized decreased with every shot that you get. So I would say to protect our hospital capacity, that is the major impact of getting vaccinated. Alex Akisto from the Herald Leader.
Hey, Governor, I have two questions. One's related to COVID and one isn't. On the COVID question, what are you hearing about multiple healthcare facilities running out of monoclonal antibody therapy? And the second one, with all the flooding that we've had across the state just in the last 10 days, what mitigation plan is working with currently to try to lessen that worsening impact, particularly in Eastern Kentucky? And if there's not a plan, is the state in the process of drafting one?
Right. So on the flooding first, the state has been providing grants to communities. We had one in the Ashland area, I remember months back, of grants to reduce flooding in the future. And that can be planning, that can be projects. The federal infrastructure bill itself has resiliency measures inside of it. And this is an area that we need to potentially look there. Some of the water and sewer projects that were already in the works in Eastern Kentucky, a number of them are designed to reduce the impacts of flooding specifically on those areas. But we now flood 52 weeks a year. Do we have to do more on resiliency moving forward? Yes. And that's really across the board on every community. And not just flooding, but in different ways, right? We are living in a time of more severe weather than at any time in our lifetimes, which means we need to be real thoughtful of the investments that we need to make and within reason to better protect our people and our property. On COVID, I have not heard about specific institutions or places running out of monoclonal antibodies, but with Omicron, with two of them not working, we don't have nearly enough for the demand that's out there. We got a whole bunch of people that have it, which means demand's going to go way up. Only one of the three works on it, and there's not nearly enough supply for the country. So we believe that every week for the next month, at least, we will likely have much more demand than supply of the monoclonals that work. Of the therapeutics that are coming out, still just a tiny amount. I wouldn't take the Merck pills. I wouldn't do it from everything that I've seen, and it only giving you a 30% reduction of hospitalization. The Pfizer pill, I know it has a name, I'm going to call it the Pfizer pill, is different. I think it could be pretty effective, but we just don't have enough right now. And that's the danger of Omicron. Is really the only weapon against it that is working, that we have a lot of, are vaccines and masks. So the only two weapons that we have that are working and working well, and that we have enough supply of, are vaccines and masks. April Rickert from WFPL.
Thank you very much. I wanted to clarify, when you said earlier there was a 17% increase in hospitalizations over the past month, is that people with COVID or overall? And by
7 days.
is, when is Omicron?
7 days. And that's overall, isn't it? No, just COVID, 17% over the last 7 days.
Thank you. When is Omicron expected to peak in Kentucky?
So we're not for sure. New York is almost double I'll call it the incident rate, the prevalence that we are right now. Now, they didn't have as severe of a Delta surge as we did, and so we don't know what impact that has, but it's possible that we are only halfway there, and that would only be if New York has peaked. So we're going to have, in terms of cases and in terms of hospitalizations, we're going to have certainly a rough couple of weeks, if not a month. My hope certainly is that we'll see cases going down in February. I hope it's not. I hope it's before then. But again, we've always thought that we had an idea of what would happen next in this, and we've had to adapt. And Melissa Patrick, Kentucky Health News.
Hi, Governor. I have a couple of hospital questions. Do you know how many hospitals are using the National Guard, first? And then second, does Kentucky have a statewide triage plans for hospitals to use if they run out of resources, as to determine who gets care and who doesn't? Third, conversation.
Go ahead.
In your conversations with hospitals, are they telling you anything about length of stay for these Omicron patients?
All right, I'm going to ask Dr. Stack to do. I'm going to ask Dr. Stack to do the triage and the hospital length, and unless he has a specific number on the Guard, I'm going to count up on my spreadsheet, and I'll have that after he's addressed the other two.
Thank you.
All right. So the length of stay, what I think the reporting is saying is that hopefully the length of stay will be shorter for the people who get admitted with Omicron. And hopefully that's the case. The governor alluded to this. This particular variant doesn't hit your lungs quite as hard. So the number of people requiring supplemental oxygen or going in the intensive care unit on a ventilator is smaller as a proportion. And the problem is when you go in the ICU and you require a ventilator, getting out and going back down that curve till you get better enough to go out to home or a rehabilitation facility takes time. So hopefully the length of stay will be shorter and there'll be less intensity on the ventilators. The second thing I think you asked about was, is there a plan for when hospitals are overrun and they don't have places to transfer? The usual plan is, if a small area has a crisis and is overwhelmed, the bigger region helps. And then you keep going in concentric circles and getting bigger. Problem is here, we have a global pandemic with a national escalation of cases and a statewide surge in cases. So the entire system is overrun. And this is why I continue to urge all the people in the public need to help contribute to the solution. One, don't go to an ER just to get a test. Only go to an ER if you really need emergency care. But two, we've got to get vaccinated, folks, because this is what keeps people from having severe disease. That's what keeps us out of the ICU and out of the hospital. And I realize right now, it's not like if everyone could run out today and all get vaccinated today, the problem would immediately go away. But the problem, whether it's Deltacron or Omegatron or whatever other variation it is, this cycle will quit sooner. It'll stop sooner if we all go out there and get vaccinated. Some of these are nursing homes.
Yeah. So the answer to how many overall medical facilities would be 37. How many hospitals would be 27? The other 10 are nursing homes or a similar type of facility. Heather Fontaine, WHAS, with our final question.
Hey there, Governor. So I have two questions. One is COVID related and one is not. First, we've talked about this demand for COVID tests. I know in 2020, we saw a lot of those pop-up testing sites, and some of them even turned out to be scams. So I'm wondering if you've heard of any illegitimate testing sites, or if you could speak to any concerns about that, the repercussions of people going about doing things like that. And then on a different topic, The jail here in Louisville has now had 5 inmates die while in custody of LMDC in the last 6 weeks. I know some are blaming it on understaffing. I'm kind of just wondering, at what point can and would the state step in to do something about this issue?
Well, first on the demand for tests, anytime, sadly, that there is money that is flowing out there, people are trying to steal it. And especially when these fraudsters, criminals can prey on fear and concern, they're out there. Now, I haven't had specific reports come in to me, but there's no question that it's going to happen. I need you to report it to the Kentucky State Police in your area, to LMPD, to the counties around Jefferson County, to your sheriff's office or police, and we will work with them to shut them down, because not only would they be stealing people's money, but they could be giving them bad information, not running tests and telling them that they are negative and or positive, which could either infect other people or impact somebody's life unnecessarily. So yeah, people ought to be on the lookout, whether it's gouging or fraud or scammers. They're just out there in droves everywhere these days, and we need to continue to fight back. I know the media is a good outlet to also take complaints or concerns from folks, and we just please ask to work with us to refer any, because we want to get them shut down as quickly as we can. For the jail in Louisville, I don't think anybody ever likes to see somebody pass away in custody or outside of it. We have not been approached, to my knowledge, about providing assistance at the moment. I know that there are a number of different issues, from staffing, which we face at the state level, to a number of other issues. We can't say we have specific criteria about when we would step in, but we are certainly always willing to help and provide any type of guidance. I mean, with that said, when it's necessary, we are at least there in expressing concern, and then trying to work to find a solution. All right. I've been at this podium a lot today. We unveiled a record amount of investment in my recommended budget for pre-K through 12 education, creating universal pre-K for 4-year-olds for the first time in Kentucky, which is oh so affordable and should be included in whoever's budget passes this year. And we saw us provide dollars in the recommendation for higher ed that can help it make up ground. And folks, we are at a transformative time in the Commonwealth. We got to have a transformative budget. Listen, we're on top when it comes to economic development. Everybody's picking us, but you only stay on top if you invest and you work for it. Now's the time to make sure in the post-COVID economy, we are a leader. But while we are dealing with COVID, take care of yourself. Get vaccinated, get boosted, wear your mask. This thing is real. Hospitals are filling up. We called out the National Guard. So we just ask you to do your part, just like every guardsman and woman is going to be doing. Thank you all very much.